So I'm Catherine Day. I'm working as I was presented at the Montreal Public Health Department. Thank you to the organizer to invite me. And also thank you to all the team at the Montreal Public Health Department who participate in the work that I will present you. This is not my work. This is mostly, I'm a key speaker today to represent all the work that was done in Montreal by the public health, but also by all the local partners and the field workers. So the plan of the presentation is to talk a little bit about Montreal Public Health Department, who we are, what we are working on, some context about the region of Montreal. Then I want to tell you a story about a timeline of community action for the early years in Montreal. And then I'm going to fast forward to 2022 to present you what I call the puzzle of the ECDEM 2022 data. The ECDEM is our EDI in Quebec. So EDI is the Early Development Instrument. I'm sure a lot of you knows this instrument that was developed in Canada, in Ontario, as well as in British Columbia. And then I'm going to finish by giving you a glimpse at the data local tour. We call it La Tournée Locale de l'ECDEM in Montreal, that is still going on in May. And what are the next steps for our organization with our partners? So I like to, as I think one of the presenters yesterday started with the key messages. I also like to do that because sometimes my presentations are too long and then you have the key messages at the beginning. So we think that the structured and well-funded intersectoral action at the regional and the local level is needed to improve such a complex outcome, such as child development and health equity. We also believe that the census type surveys, such as the ECDEM and the EDI, that is well developed and implemented in many countries, it provides powerful opportunities to mobilize local communities toward action. And they also allow them to identify and prioritize some thematic priorities based on these local data. And of course, survey data must be interpreted with caution, with political, social, economical, geographical, temporal context. I will show you how we've done that in Montreal. And we also believe that merging of knowledge and practices is necessary. So that means that we can combine research data, surveillance data, and monitoring data on a quantitative side. And on the qualitative side, we also value experiential knowledge, such as the citizens and field workers' perspectives, as well as children's perspectives. I'm going to show you what we've done recently with the children's consultation. So this is Montreal Public Health Department. We work under the Quebec Public Health Act that was created in 2003. We have a regional and independent mandate, and we are working over all public health functions, such as health protection, health promotion and disease prevention, surveillance, and we also do a little bit of evaluation and research, but I just want to tell you that I'm not a researcher. Maybe it's a kind of a different presentation that I will present you today, but we consider ourselves as knowledge users, and we really believe that your work as researcher should be connected to our work on the intervention side. We work very closely to different partners from different sectors. So the Ville de Montréal and all the boroughs in Montreal. We work very closely with community organizations, childcare services, school and education sector, as well as workplace, and of course, the healthcare system. So in Montreal, we have 5 priority actions. So the first one is child development. So I was really glad to hear about this priority. And I also think that this priority has impacts on all the other ones. So child development has impacts on youth mental health, also like in many decades on healthy aging. Building trust and competency could also avoid some of the opioid overdose that we are seeing here in Canada, in Montreal particularly, and in British Columbia. And the last priority, not the least, the climate change, which is considered, as you may know, as the most important health threat for children in the next years. Oops. Welcome to Welcome to Montreal. I know many of you know some of the characteristics of the city, but I really wanted to give you some context because the social, economic, and the demographic is really linked to ECD outcomes, ECD being early childhood development. So in Montreal, the region of Montreal is the island of Montreal. So we have a total population slightly over 2 million people. We have a density of 4,000 by square kilometers. For families with children, it's over 300,000 families. And especially for children 0 to 4 years old, we are nearly at 100 children, which represent 5% of the total population in Montreal. These data are from the 2021 census, and I will explain you how since 2021, we believe that our population already changed. So this is in green, the island of Montreal. Can you see my arrow? My arrow, no. And we are surrounded by other regions. So in the pink, you have the Laval Island, and we also have the North Shore and the South Shore of Montreal, which compose the Greater Montreal. But if we stay at the region of Montreal, we have on the municipal system, the city of Montreal with 19 boroughs and also 14 related cities. On the health system, we have 5 local authorities. We call them CRCHUM. I spare you the abbreviation. And we are working in a kind of weird governance because local authorities are independent. We do not have some hierarchy over them, but we still have accountability. On the education system, we are working with 5 school boards. 3 school boards are French-speaking schools, and 2 school boards are about English-speaking schools. So between the 2016 census and the 2021 census, many things changed in Montreal as well as in the province of Quebec. So if you look at the immigrant families, among those who have 0 to 4-year-old children, you can see that we are now at 67% of immigrant families. So we now have a majority of our families who are immigrant. If you look at the recent immigrant families, that means that they moved to Canada in the last 5 years before the census. You can see that we also have a major increase in Montreal, but look at the increase in the province of Quebec. So the trend is higher, but we still have a higher proportion of recent immigrant families in Montreal. Then look at the families with children living under the low-income threshold. This was quite a surprise for us because we can see a major drop in children poverty. And it can be explained by a supplementary income that was provided by the government during the pandemic, because the census was during the pandemic. And there was also some new federal family benefits in Canada, which we hope that will stay as a more permanent policy than the supplementary benefits during the pandemic. So we see this drop in children living under low-income threshold in Montreal. We also see this drop in the rest of Quebec, but in a lesser extent. So it's possible that our poorer families also left the cities and moved to another region during the last 5 years. And now we are also using the measure of consumption baskets to better capture deprivation, but we didn't have these indicators in Montreal for this 2016 census. I want to say a few words about the Roxham Road. So during 2021 and 2022, we had massive affluence of migrant families during and after the pandemic. And it was mostly through the Roxham Road, which is at the border of Quebec and United States. So people were coming from United States at this very popular but illegal entry point. And look at the number in 2021. And these are like registered crossing. So there was like over 4,000 in 2021. But in 2022, we had almost 40,000 crossings. So this was the peak affluence. And in 2023, the government decided to close the Roxham Road. So you can imagine all the pressure that we now have on all our healthcare systems, social services, schools, childcare services, as well as housing issues. This is mostly the same data. So now this story about what we did in the 20 last year in Montreal to work with the early years. So you can see this graphism tentative. I tried to do some graphism, but this is not my expertise. So the EDI was created in just before the 2000 year. Then in Montreal, we had the first EDI survey in 2006. And between these years, the EDI was implemented in 4 Canadian provinces, so Ontario, British Columbia, Alberta, and Saskatchewan. Then in Montreal, we were the first one to implement the EDI. And in 2012, this survey was generalized to the rest of the provinces, In 2012, we decided just to keep going with innovation. So we decided to create another survey, which aims was to better document the early years. So the childcare trajectory of kids before they were coming to kindergarten. And in 2017, guess what? The Quebec government decided to generalize this regional survey to the rest of the province. So this means that our team was, I think, pretty willing to do some innovative work. And we were building on a very strong community-based mobilization for the early years, even before the EDI was here in Montreal. So I will go on later on the other steps after the EDI. So how it started in Montreal, it was the idea of Richard Lessard. So I want just to pay a tribute to the late Richard Lessard, who was a mentor and a pioneer in public health in Quebec. He died 2 years ago. And he was a former director of public health in Montreal for 20 years. So it's such a long time. He was a leader for pushing the EDI agenda in Montreal. And I would say it was against the wind because all the community organizations at the time were against this kind of survey, saying that it could create some discrimination and stigmatization for children. And I think he was inspired by Clyde Hertman. We did evaluate the impacts of this survey in Montreal. So this is the work of my colleagues Isabelle Lorrain and Angèle Bilodeau. So they evaluate what was the impacts of the survey and the 12 local summits. So we call local summits when we go down in the communities and we present local data to different local field workers. And we also had at the time a regional event. There was some major positive benefits on the early years mobilization with the creation of local committee for the early years in almost every neighborhood in Montreal, involving health sector, childcare, school, municipalities, and community services, all working at the community level toward actions to help improve child development and reduce health inequities. There was some local summits in the 29 local health territories, and one of the action that the communities wanted was to create some neighborhood meaningful for them, so socially defined neighborhood. And this was done just before the first data collection. And we call these very small geographical areas, we call them voisinage. So the island of Montreal is divided in 101 voisinage at the time. We now have 111 voisinage in Montreal. And we are using these geographical areas not only for child development, but for many health outcomes and administrative data as well. At that time, we also had a new regional intersectoral committee on early childhood. This was a direct impacts of the EDI survey, and it was called Horizon 05. And Horizon 05 decided to do a strategic planning with coordinated efforts to address priority issues in Montreal collectively. And there were also some committees at the local levels, as I said. So what were the main priority issues defined by Horizon 05 with over 20 organizations? They decided to work on the school transition with the entry to kindergarten, how to reach out isolated families, how to develop pre-literacy intervention. We call it éveil à la lecture et à l'écriture. They decided also to share data and having a common lecture of what are the main issues on Montreal children, like speaking the same language using the same data. And of course, they really wanted to have better childcare access and quality. About this topic, I'm just going to do a kind of a zoom about what we've done, listening to the partners about access and quality of childcare services in Montreal. So this was the second survey developed in Montreal after partners telling us that we need to know what's going on before kindergarten. So it was a new survey about children preschool trajectories. Then we did some analysis to compare the, I would say, the places in the CPE. You remember the CPE from yesterday, the publicly funded childcare model. So we decided to do an analysis by area deprived quintile. So Q1 is the most advantaged communities, and Q5 is the most deprived communities. And you can see that the CPE places are always higher in the most advantaged areas. And as Sylvana Cote said yesterday, it should be the inverse trend, because those children who benefit from childcare with high quality are those from the deprived areas. This is the map of Montreal by neighborhood. So you have the CPE places in the small blue dots, and you have the deprivation index on the background. So there is a real mismatch, and this was in 2021. We are still doing the update for the recent data, but we're pretty sure that there's not so much change in the last years. We did at the Montreal Public Health Department publish many position papers on childcare services, on the access of these services, about the importance of quality of these services. And we did present these position papers directly to some decision makers, for example, at the Ministry of Family, but as well at the National Assembly. We did have some success to influence public policies. So after releasing one of the position paper, there was a reaction for the Minister of Family saying that it was not acceptable and that he wanted to develop new permits for CPE in the most deprived area. We're still waiting for that. We did have very interesting data on the childcare access, but in the last decade, we didn't have any information about the quality of services. This changed last week as the Vérificatrice Générale, she's an independent reporter. She published new data from an independent report about childcare quality in Quebec. This is since it was mandated by the government since 2018, we have this new act about improving quality of childcare services. So this is a release from last week in the media. So in blue, you have the percentage of childcare services who failed the evaluation for quality. You can see that these percentage of failing are very high. They are very high, except for the publicly funded CPE, which is only still high, but it's 21% of these well-funded CPE who failed the evaluation for the quality compared to the private childcare. There is not so much difference between the subsidized and not subsidized private childcare. And we do not have any data yet on the family childcare model. I'm going to move forward. So now we are now in 2022 on my timeline. We did have a recent collection data with the ECDEM. So we had the last one in 2017 and then this one 2022. So it's before and after the pandemic. We did anticipate a worsening of inequalities in the ECDEM data between these 2 years, especially in Montreal, because usually we have more poverty, more immigration, more language barriers, and we did have more restrictive measures during the pandemic. But you will see what happened. So in Montreal, I will use DV1 because it's saying every time developmentally vulnerable in at least one domain is quite long. So we have 28% of DV1 children in Montreal. You can see the difference in local communities, and you can see the data for the Quebec province. So there is not so much difference between Montreal and Quebec. It's the first time that we do not see these differences because usually Montreal has worse outcomes. We also like to present DV2 indicators, so children developmentally vulnerable in at least 2 domains, because we think that one domain maybe is, I would say, unstable data, especially because of the specific issues in Montreal having school, French-speaking school, English-speaking school, and sometimes children speak English at home and they go in the French-speaking kindergarten, so it has influence on the EDA data. And we think that children who are learning 2 languages are less at risk than children who usually speak only 1 language. This is from the literature. And we think that if they speak English at home and they go in the French kindergarten, if they have like good social support, they have parental education, they are not as risk as the other one. So this is the map with the results. I just want to highlight here one territory, this is Dorval-Lachine, just to explain the one domain versus the two domains. So if Dorval-Lachine is an English-speaking community, so you see that it's like in the dark orange with the DV1, but when you go to the DV2, it's like in the pale orange, just to illustrate what I was saying about bilingual children. The key points about this data. Since 2012, the proportion of DV1 is stable in Montreal. You can see the trend in 2012, 2017, and 2022. But we observe a very different trend in the rest of the province, where this proportion increases through the last decade. So we started at the Quebec provinces in 2012 with almost 26 children being DV1. And now there was an increase between 2012 and 2017, and there was still an increase between 2017 and 2022. So this was quite a surprise because we anticipated a worsening of our results through the before and after the pandemic in Montreal, but we didn't observe that. And we saw a different trend in the rest of the provinces. So why? These are the region in the surrounding Montreal. So these are region part of the metropolitan area of Montreal. You can see that the differences for the Montreal region is a reduction in vulnerability, but in all the four surrounding regions, we see an increase. So it might be because families are moving from Montreal to the banlieue, so the region outside Montreal where the housing is less costly. As in all other EDI results, we saw some association with boys, with children born outside Canada, with material and social deprivation at the neighborhood level, as well as children whose mother tongue are other than official language. A particularity in the Quebec is that our results show that English-speaking children are just as rich as allophone children when we compare them to French-speaking children. So this is just some relative risk measuring inequities over time for boys versus girls. You can see that there is not so much reduction in the inequity gap. The same for immigrant children. So we maybe see a small increase in the equity gap when we just calculate some basic relative risks. And the equity gap for the most deprived areas, it just stayed the same over the last decade. So what could influence the results of the ECDEM? Many different factors. First, differences in methodological issues about who is included, who is excluded, demographic and socioeconomic change, access to quality childcare services, access to healthcare services, including prevention, social and community resources, build environment and living conditions for family, and the pandemic. So the EDI results are not simple to interpret. We need to take into consideration many, many different factors. So this is just to show you that the children who were collected in 2022 are probably not those who were the most impacted by the pandemic because they were born in 2016 and 17. The data collection was when they were in kindergarten, and the start of the pandemic measure with all the school closure and services closure were when they were already 3 and 4 years old. So these children are now in the second grade of elementary schools. Because I lack some time, I will just jump over these interpretation avenues. We had some question about methodological differences between our cycle data. We also saw some demographic change with the census data that I showed you previously. And maybe in the other hypothesis, we can say that we are doing great work working all together in Montreal. So because we have this historical community mobilization for the early years, we work very closely with community organization, health system. There is some connection with educational childcare services, health system, and schools. We are more and more working with cities and boroughs. And we try, like we do today, to include and involve academic as well. So what are the next steps for us in Montreal to interpret the ECDEM data, but also to go beyond and talk about child development and health inequities? We need to explore further this stable trend in Montreal when we compare it to the rest of Quebec. So we are going to do some multivariate analysis to control for demographic change. We want to do some language subgroup analysis. We want to keep going on doing comparisons to other regions, other provinces, and other countries, because many countries use the EDI. We are going to do, we're almost done with doing the ECDEM local tour. This is the next slides. And we want to do some exploration of diagonals communities and case studies. This is based on some methodology that I learned in Australia in Sharon Goldfeld's team. So we want to explore what's going on in communities where there is children development outcomes that are different than what we usually expected, because usually we have a strong socioeconomic gradient between census data and EDI results. But sometimes the communities and the results of the EDI do not follow this trend. So we want to just go further and try to understand what are the characteristics of a resilient community. And we all are almost done with the ECDEM local tour. So this was organized by our team at the Montreal Public Health Department and many local stakeholders. So in each event, we had participants from many different sectors, and it was done from March to May. And there's over the 21 events, one is lasting, so we are almost at the end. Unfortunately, I do not have the results of the local tour for you today. So the objective of the local tour was to present the data, to gather field experiences from partners, what are their opinions about the main challenges for families at the moment, and potential actions and innovations, and highlight promising initiative. It was opportunities to exchange with field workers, health professionals, and as well as administrators, and hearing directly the voice of families. So you can see that it was quite a big organization with 21 events in local communities. Of those, 4 events were directly with families, with parents consultation, and we also did 2 consultations directly with children. So this is an example of a local event in the Villeray-Petite Patrie neighborhood. We had 43 participants. You can see that they are coming from different sectors. This is the proportions coming from different sectors. Majority were coming from community organization. And about consultation directly with children, we did 2 events directly with the young children, like age from 4-year-old to 8 years old. There was 2 different types of activities with storytelling. It was twins going on an island, and they wanted to go to school, and with their parents, they needed to learn to what is cool, what is new. They were asking questions about when they enter schools, and the type of question that we were asking to the children. How did you learn to, for example, use scissors? How does it go when you need to control your emotion, for example? And what advice would you give to your friend if he has to resolve a conflict with his friends, for example? And the next step, with all this interesting material, we're going to publish an annual report of the Montreal Public Health Director. I think the Public Health Director is in the room. Mylène, are you there? Or maybe she had a meeting, but she's on the panel this afternoon. So I will be writing the report on behalf of Mylène Drouin, who is the Montreal Public Health Director. The report is not only on the early years, the early years and beyond. It's based on ECDEM data, but as well new surveillance data, literature review, and the summary of the local tour. What are the perspectives of the field workers, the parents, and the children on these data? And as all the other annual report of the Public Health Director, we really want to have a specific recommendation and commitments, and the recommendations are addressed to the policymakers. So it will be launched in next October. So I'm back to my key messages. So structured and well-funded intersectoral action is needed to improve such complex outcomes. Census surveys are powerful tools to mobilize communities, and when they are working to identify collective priorities based on local data, it can be very powerful. We have to be cautious because we have some demographic change, socioeconomic change that are very associated with the EDI results, and the merging of knowledge and practices. So the quantitative data combined with qualitative data is probably the best way to go. Thank you.
Go on.
I'd just like to mention Richard Lessard, who was the director of public health for 20 years that we saw a photograph. He was in fact a big supporter of INRICH in the early days in 2008. He was at the first meeting and supported it wholeheartedly. So thank you.
One quick question, Sharon. Sorry, Sean, like Sean, Sharon, Karen.
Maybe Sean is like my Irish version or something. So first of all, thank you so much, Catherine. And it was a joy when you were in Melbourne, and it's wonderful to see how your thinking's evolved and also how the work has evolved. And you may not be able to answer this. In fact, I'm sure you can't. But I think this is the really interesting thing about having measures of child development that are the same in different countries. And it's a real opportunity to look at what the previous conversations have all been about, which is what's the policy environment that makes the difference to these outcomes when you have the same measure. Because in Australia, we have lower rates of developmental vulnerability. I have no idea why. So our rates, yours were 28% here in Montreal. In Australia, ours are about 21% across the whole country. And we've done a Montreal-Melbourne comparison. The other thing is, I think your inequalities have gone up. So for developmentally vulnerable on 2 or more, we've got about 3 times the difference between the lowest and highest income area. If I had a look at yours, it's just over that now for Quebec. So I think there's this kind of interesting dissonance between Quebec that's got this kind of interesting and innovative early childhood education and care system, but actually isn't delivering better child development outcomes than Australia. We have a pretty crappy early childhood education and care system, but seem to be delivering different outcomes. And I think this is where these sort of conferences, we should think about how we set up these opportunities to look at how internationally the different policies might be translating into real developmental outcomes. And I think part of the story was the slide you showed about the number of poor quality centres. You know, when you lift the hood on service delivery, our experience has been that in fact mostly it's delivered poorly and inequitably. So it looks good at the high level, but when you actually get in underneath, it's not so great. So you may not be able to answer all of that, why Montreal has different early childhood, but I wanted to highlight the importance of having these measures across the world. And if any of you don't have the EDI in your country, you should think about whether or not we could do this. And just a shout out to, is Jennifer still? No, she's not here today. Oh, you were there before. Yesterday. The great thing that Jennifer did was that wonderful study, which was EPOC, which is our ability to study different cohorts in different countries and look at inequalities and kind of hypothesize whether policies might make a difference. Wouldn't it be interesting now if we started to do that around some of our administrative data and do the same sort of thing and get to not precision public health. David is wrong. I'm not into precision public health, but I am into precision policy. And I think there's some real opportunities. Sorry, it wasn't really a question. It was more really.
But it gave me the opportunities to just comment on. I've been working with the EDI survey for the last decade, and for me, the absolute proportion of like the 28% itself, it doesn't mean anything. Like it's a relative measure, and I think the instrument was really conceptualized to do comparisons. So that's why it's more interesting to compare inequities, to compare geographical areas between them, and to compare, like to do some temporal comparisons. Because when we launch only like in the media, like almost one on three child is developmentally vulnerable, I think it doesn't help at all. And it's also, for me, it became more of a community mobilization tool because the results are influenced by so many factors, then it's really hard to pinpoint this is what makes the difference. So it's a survey, it's very interesting quantitative data, but it's also a very powerful intervention tool to help going further in early years interventions.